So grew up in a family of medicine. I grew up on the East Coast outside of DC, and my father is actually an oncologist, and my mother is in nursing and nursing education, and she worked at a hospital with quality and education. And I was always around it and always kind of dabbled with the idea of being a doctor and loved biology and all that good stuff. And then I went to the University of Virginia, and during that time, I was really still, East Coast, as you live on the East Coast, so really, battling like that. Should I become a medical doctor or a naturopathic doctor? And this was still, very much, I think, it was starting to gain traction, but still very, not mainstream at all. And so I had some really interesting events. You look back and see how the seeds are planted right on your timeline. And, my mom had a good friend who had a cancer diagnosis, and she found somebody who went to Bastyr. So that was the first time I had heard of Bastyr. And I was really excited about that there even existed the field of naturopathic medicine. And then when I was at UVA, I went to a course on complementary and alternative medicine, and a naturopath taught that course. And one of the speakers was actually Dr. Jerry Tennant. And so that was back in like early 2000s. And he really planted a seed in my brain about energy medicine. And many of you might know his story, but he was one of the first doctors who did the LASIK surgery. And so he potentially had a viral exposure through his eyes that got into his brain. And he had debilitating chronic fatigue for about 13 years. And what changed the course was a instrument called the scanner, which worked on basically polarity and this concept of negative and positive charge in the body, and recognizing viruses through that, or mounting an immune response through that. And so that was really pivotal, just, hearing that story. And so my path led me to Bastyr. And honestly, I was one of the youngest people in the program at that time. I was 22. I moved across the country, and it was a big culture shock. You think about health, and then you're, in Seattle, which was very different from Virginia, and Bastyr was very different. And I still had that inner conflict if this is the right path or not for me. And I did something very out of character. And I decided to take a year off, and that year became 2 years. And in that time, I had this, again, incredible journey, and I met incredible people along the way that just led me back to naturopathic medicine. And, I did an event with like Dr. Perlmutter and Dr. Ray, and, learned about mercury in the mouth. And, I even, took the MCAT, just getting really close up to that, possibility. And in that moment, I was like, this is not, for me. And so I found my way back to Bastyr. And one of the first lectures during that time was with Louisa Williams. Do you know her? She wrote a book called Radical Medicine. And if anyone out there wants to learn, probably the conversation we're going to have more and more, it's like the textbook of, I think, the medicine we both practice. And it talks a lot about bioregulatory medicine and the concept of interference fields and the dental connection and, all of these things. And I just remember sitting in that class, and she was like, what is the first thing that you do when you have a patient walk in your room? And we're like, oh, ask them if they eat gluten or, whatever we're thinking. And she's like, you look in their mouth. And that just really struck me. And she was a very influential mentor in my life. And so kind of everything was all timing for me. So I came back to Bastyr, and everything just fell into place. I had wonderful mentors. I, really had a wonderful experience. And then after graduation, I had a lot of opportunity to really dive in and study bioregulatory medicine. And here we are 12 years later. And, it's just, we're in that paradox, right? That even though things are becoming more censored and more polarized and everything, there's also this opportunity to share these conversations that we're having way more than when I graduated. So that gives me great hope that we are, we're getting there. We're getting there on really sharing with people the real reasons why they're sick and giving them tools. And, I know that we shared a passion, and how can we shorten that time, for people to get the proper diagnosis or whatever, we want to call it. And then, really, I still feel very much that we're in a quest to finding the more elegant path to healing, because I think we know a lot and we have a lot of great tools, but I'm still not satisfied as how long it still takes people to get better. And so that really propelled me on a path to look at biophysics and, study, the whole energy medicine perspective, because I think that integration with what we would call biofield science with, functional medicine or bioregulatory medicine or whatever we want to call it. I think that's the future of medicine that I'm really passionate on learning about, sharing with my patients, and really creating a conversation about. So that's a long-winded story of where I got.
No, I mean, it's your story. It's not long-winded. That's great. And I think it's so true. And I find this, across lots of doctors I speak with, it's like you start going down one path and you find yourself on another. And that's the beauty of medicine. It is a dynamic science. It is constantly evolving and changing. This idea that there's one right way of going about medicine is like bonkers to me. It's like there's only one way to go about life. It's just make money. You know how many people are miserable on that path, right? Because it's not the only path. Maybe for some, that's their path.